What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far, and I hope you are testing negative for the viruses. It is time now for the Wednesday edition of the Virus Update for Wednesday, July 9th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to know what's going on with these viruses. That's what I do here on my channel each and every day. Want to stay informed? Just subscribe to my channel down below. If you like today's video, give it a thumbs up. Let's try for 175 like button hits today. Share this video with anyone you know. And of course, leave your comments down below. Already, we do have several things to talk about today. Several different viruses as well. So let's get right into that. Starting off today with none other than measles news once again. Yeah, it's been a while since I've actually started the video with measles news, and we usually just include it later in the video, but yeah, there's a lot of measles news today. First off, positive measles case identified in Putnam County. This is in Indiana, and it looks like a person has tested positive for measles there, and as you know, measles has been continuing to be a problem all across the United States. Indiana, it's a problem there as well. Then we move not too far away to Kentucky. And Fayette County, Kentucky is now reporting that they have another case of measles, which is being connected to the ongoing outbreak that began in Woodford and Fayette counties. And it says, according to the health department, there are now 9 cases linked to this particular outbreak. The newest case was reported Tuesday, and it brings the total to 5 confirmed cases within the same household in Lexington. So that's not good, and all the patients do remain in quarantine. And then we go over to South Carolina. Confirmed case of measles in upstate South Carolina, health officials say. This is the first confirmed case of measles reported in South Carolina since September of 2024. Department of Health officials said the individual is unvaccinated and did not have immunity from a previous measles infection. So we pencil in another state which is now dealing with measles, and not included here in today's update because I don't have it queued up. It's one of those paywalled news sites. There is another case of measles now in Missouri as well. So measles continues to spread, and we should expect at least a moderate amount of new cases on that CDC update on Friday. Moving on to this. Why long COVID may hit toddlers harder than thought. Now, we're not going to read this whole thing, but we are going to read at least the first part of this, because I find this to be very interesting. In young children, the long-term effects of SARS-CoV-2 infection may differ significantly from those in older children or adults. A recent study in JAMA Pediatrics systematically investigated the symptoms experienced by children under the age of 5 and the frequency of long COVID in this age group. Get this. The analysis revealed that 14% of infants and toddlers and 15% of preschoolers in the cohort showed symptoms consistent with long COVID. That's not good. So yes, long COVID is impacting infants and toddlers as well. Long COVID's impacting everyone, but now we're finding out that old narrative, from the early days of the pandemic, oh, kids can't get COVID bad. Well, guess what? They can, and they can go on to develop long COVID. COVID can become long COVID. Long COVID, for those who do not know, maybe this is the first video you've tuned into, you get COVID-19, a week goes by, another week goes by, time goes by continuously, and you don't fully recover or something new starts to happen. That is long COVID. There's over 200 to 250 different symptoms of long COVID. Long COVID can go on to various different sleep disorders, various different heart problems. There's a whole slew of things that long COVID can do, all stemming from your initial, I'm not feeling well. I tested positive for COVID after taking a test. And it can lead to a whole bunch of different problems. And now we're finding out the truth that kids, infants, toddlers can go on to have long COVID complications. We already know that kids can go on to get asthma from COVID infection, so this is not good whatsoever. Moving on now to this. This is a poll question I ask from time to time. It doesn't have a lot of votes this time, but it does have some, and I will share this with you. We are far enough post 4th of July that it is time for me to ask the question, do you know someone who is sick right now? Anyone from around the world can answer, and any virus counts, not just COVID. If you are sick, that is a yes. In other words, if you yourself are sick, well, you click on yes. 52.9% said yes at this time. 47.1% said no. So more people right now are starting to know someone who is sick, or maybe themselves is sick. All right, taking a look at what's going on in India today with the active number of COVID cases, and that is coming up at, there it goes, it refreshed, 796 active COVID cases, and it looks like they did add 2 more deaths today. The active number of cases continues to drop in India. And if you notice, from the day it peaked in India, there hasn't been, I don't think there's been a single day that's gone back up whatsoever. They've all been down, 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 down. Really strange how that is in India. We all know, we can all agree, they miss a ton of cases. All right, speaking of cases, let's go to another virus now. Whooping cough in Japan. This is ridiculous how bad this is. Japan's whooping cough cases hit new weekly high. Yes, I said weekly high at over 3,300 cases, meaning they added 3,300 new cases in 1 week. Just 1 week. I mean, that's more than most states here in the United States do in 1 year. So this is really bad. Tokyo, whooping cough continued its surge in Japan, reaching a new weekly record of 3,353 cases, the highest since the current survey method was employed in 2018, a National Health Research Institute said. Yikes, that is a lot of cases. They have a serious problem there, and I don't know, I think they need to do something to figure that out. All right, let's go back to children once again. Now, I believe this comes from UK. This is a UK website. We're just going to read a headline here. Over 1 million children living in homes causing asthma and chronic illness. Well, I can speak about the asthma part. Clean air. I got an air purifier behind me. We got another one downstairs. You need to be using air purifiers. Air purifiers can help clean the air. Dirty air does cause a lot of these problems. So even if it's too late, it's not too late to start cleaning your air, because clean air can really help. And again, we're talking about over 1 million children over India. I'm assuming they're just talking about the UK only. I don't see anything about other parts around the world. But yeah, this is really bad. And it's not just a problem in the UK. It is a problem all around the world. It's a problem here in the United States. It's a problem in the UK, Canada, name your country. There's a lot of kids that are exposed to things that they shouldn't be. Maybe it's mold. Maybe it's because it's an older household. Just a whole bunch of different things that cause problems. And it is not good to be breathing in this stuff. All right, moving on. Just a little FYI, friendly reminder here. This is from the World Health Network. Want to reduce your risk of heart disease? Yeah, who doesn't? Avoiding COVID could play a bigger role than you think. Even a mild infection can strain your cardiovascular system, raising your risk for serious complications over time. Your heart health matters. Protect it. Now, you and I both know there's a lot of other things that increase your risk of heart disease. Eating too much fast food, such as McDonald's. Let me tell you, when I do deliveries, there are some people that at least every time I'm in a certain area, I'll deliver to that same person from McDonald's multiple times. I mean, eating too much of that's no good too. But guess what? Catching an infection of COVID can increase your risk for heart problems. We've had several studies lately that link COVID to increased rates of heart attacks. Yes, and all these different things. Oh, not good. Has that convinced you to take COVID more seriously? I hope it has. If not, we continue on, taking a look at this now, the state of Vermont. And really not much to show here. Vermont is doing pretty well for COVID. Vermont is continuing to be very low at this time. They are not trending upward at the moment. Their pandemic death total, still one of the best in the nation, is at 1,299 as of June 28. All right, taking a look at what's going on with COVID in India. They've had 1,049 cases in the last 30 days. 26 cases among healthcare workers in the last 30 days. 64 years is the median age. 47 males 47% of males are testing positive, 53% are females. Deaths in the last 30 days, 9. Recovered in the last 30 days, 474. And it looks like this is still up to just the end of June. We're not seeing new data for July just yet there. But I figured, you know what, we haven't showed Italy in a while, so let's see what's up on the page and, let's report about it. All right, moving on now. The Canadian viral activity levels. I have refreshed this. It looks to be the same as it has been. COVID-19 wastewater viral activity level is moderate. Flu A is low. Flu B is low. And RSV is low at this time. UK, we will get that COVID update tomorrow. We will have a virus update tomorrow afternoon, probably around similar time as today, or something like that. Taking a look at what's going on with air qualities in the United States. You're seeing this purple and red in Northern California. I believe that is wildfire related. I also believe we have some wildfire troubles up in Canada as well. And then from about the Great Lakes on southeastward, we'll just say all the East Coast almost, dealing with some poor air quality today. So what does that mean for the Weather Channel's breathing index? Well, not great in Pennsylvania. I will say this, though. I'm doing better than yesterday. I'm not coughing as much. I haven't been outside as much yesterday. The only place I went to was Whole Foods and another grocery store. That was it. I didn't do any deliveries this morning. I will tomorrow. Taking a look at what's going on here out to the west, we do see bad breathing index in the Four Corners region, California, Nevada, several different states there, Utah. That's concerning. And a little bit of poor breathing qualities in the southeast. I mean, not perfect, but not great either. All right, moving on now to Pinellas County, Florida. And oh my, this is not good. Oh my, look at all this. These are active live calls right now. And take a look at this. We see sick person not once, not twice, not 3 times, 4 times, 5 times, 6 times, but at least 7 times right now. 7 different calls for a sick person. That's not good. And there are some other calls going on as well. Philadelphia yesterday, 807 EMS calls have been reported for yesterday. 807 EMS incidents, I should say. Doing a live look in at Montgomery County, Pennsylvania. We can see not too many calls right now. 1 for respiratory emergency, several for vehicle accidents. That's never a good thing. And believe it or not, when COVID cases start to go up, the number of vehicle accidents go up. When flu and all the other viruses go up, the number of vehicle accidents go up. We are finding that people who are sick have a higher chance of getting into an accident. Yeah, there's been a couple studies about that now. We shared them a few months ago on the virus update. At least I recall us doing so. If not, it was tweeted out. But the point is, if you're sick, yes, it can impact your ability to think. And, well, driving. Have you driven nowadays? There's some crazy drivers out there. You need critical thinking. Heck, you know what you also need when you're driving nowadays? You need eyes all around. I mean, it's just ridiculous how bad some of these drivers are nowadays. Chester County, Pennsylvania, a couple sick person calls. Taking a look at what is going on in Bucks County, Pennsylvania. And I know 0 cannot be correct. There we go. They have 8 calls right now. Various different things. Respiratory distress is showing up, and a few other things as well. Taking a look at the hospital situation in Pennsylvania. Hopefully we do not see a bunch of yellows today. Lehigh Valley, Pennsylvania, we're seeing a few yellows. And remember, it is very hot here. Like here in Philadelphia, or I'm in northeast section of the city, it is 92 degrees right now. With it being that hot, you have to remember to do something. Hydration. Let's pause and take that hydration break. A drink of water would be very good right now. Maybe juice, maybe something with electrolytes, whatever you want to drink. Now's a good time for a hydration break. Water is usually my best choice. So, doesn't that feel much better? All right, moving on now to this. Just want to take a look at emergency department visits in Pennsylvania for respiratory viruses. And that is currently just under 8% of them. We're not seeing an increase for COVID or RSV at this time for emergency department visits. That is some fantastic news to report. Let's take a look at what's going on in New Jersey with the hospital situation. Let's refresh this. And we do see a patient volume issue at Central State Medical Center. And we also see, Inspira Medical Center, Malka Hill, patient volume issue. Mannington's also has a specialty issue. And everything else is fine at this time. So just a few issues at this time going on over in New Jersey, taking a look at what's going on in New York State. And we do see there are 260 people who have tested positive. That's up slightly from yesterday, but overall, they are still not seeing a major surge yet. And XFG, some are saying, has taken over there. So this is really interesting. New York City gets added in tomorrow. Take a look at this. We're taking a look at what's going on with hospitalizations in New York State. 210 and 20 people in the ICU. I think there's a wild card to be watched. Can New York State get below 200 COVID hospitalizations before they go back up again? That's something we're going to have to keep an eye on. If that happens, I don't know if that's happened since 2020. I really don't. I'd have to go back and take a look. All right, let's take a look at what's going on with some wastewater sites. We'll just do like 2 or 3 today. Bangor, Maine. Here's one we have not looked at in a while. Bangor, Maine. You can see here it is trending upward slightly. Upward trend in the last 21 days. Medium concentration. We do see medium norovirus at this time. And everything else looks to be okay. All right, let's go somewhere down south. Again, like yesterday, we can see here, there are still continuing to be a lot of gray sites. I am seeing this in North Carolina, Kinston, North Carolina. COVID there, it is starting to go upward. I'm also seeing norovirus is listed at medium. Let's go back to COVID. No trend in the last 21 days. Well, it looks like this trend just literally started, so it doesn't go back a full 21 days. It is medium for COVID there. Let's go somewhere out in the west now. And how about we take a look? Ooh, there's a lot of places. Wow. Almost everything is grayed out here. Let's go up to Salt Lake City, shall we? And in Salt Lake City, we are seeing low for COVID. Everything else is not bad at this time. Norovirus is in the medium category at this time. And we'll do one more wastewater site because we can. And this wastewater site is not doing good. This is Traverse City, Michigan. It is medium for COVID. Norovirus is running high. And are they still seeing measles? Yeah, wow. Several detections of measles, which means more than one person is likely infected with measles in this area. Alrighty, folks, that does it for the Wednesday edition of the Virus Update. If you enjoyed today's Virus Update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And ways to support my channel are listed down below. We will have another Virus Update again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.